All right, this little technique is for stretching or trying to reposition the cervical spine. So occasionally I'll get a client or a patient where the midline position of the neck is slightly shifted. So in this case, we have a right shift of the head. And in order to keep my head level, I'm slightly side bending to the left in order to get my eyes level. So there's slightly this off-centered positioning. So in terms of a stretch, I'd want to pull this back to center, but if I'm tilted, I pull it back to center, I still have to tilt to the right as well. So in this case, I'm shifted to the right with my centering, and my head is slightly tilted left to keep my eyes level. So if I take a nice hot shower in the morning, this is a really good time to get this stretch in. So maybe a little face towel, or even every time you use the restroom or go to the bathroom and wash your hands, most people maybe have a little towel hanging out near to wipe their hands off with. Something like a face towel or a bath towel is fine. So what I'm going to do is I'm going to try to find the right segments or bones in the neck that might be contributed to this stuck position. I'm going to take the edge of the towel, pull it around the side of my neck, so I'm basically hooking the right side of the neck. I've got the edges of the towel held here, so I'm not so tight here I'm choking myself at all, but I'm shifted to the right. Now I can pull myself to the left. I'm going to take the same arm here, and as I pull my head back towards my left, I'm also going to tilt my head back this way. So I'm shifted here. So if I were correct just the centering, my head's tilted this way, so I have to kind of reach over the top, pull back to the right as I pull the towel to the left. So I'm taking the shift and I'm centering this way. So I'm using the towel to do that. Now I can move the towel up and down on different sides of the neck, or different levels of the neck I should say, and maybe try to find that mid-cervical area between the base of the skull and the top of the shoulder. And I can use that edge of the towel up and down and try to find the one that feels the stiffest. So I'm going to take this towel, loop it around the side. I'm going to now pull back to center and tilt. Now I got that little stretch going. Now that I have this going on, I'm going to activate the chin tuck exercise, which is basically pulling the chin straight back into the throat. So it's not looking down as much as it's sliding backwards. So it's this little chin tuck pump while I'm holding those two positions, pulling with the hand on the towel and doing a little tilt of the head, and then adding the chin tuck to try to unlock this stuck position over here. And in a way I'm taking it kind of over here, which is the opposite of this, in order to unlock it. And so hopefully if I can get equally amount to the left as I can to the right, the split difference there would be more centered. So every time you go in the shower, heat up the muscles. It's a really good opportunity to work that little stretch and add the chin tuck. So how many chin tucks? I would go for a set of 10, 4, 5, 6, 7, 8, 9, 10, and stop and rest and do 3 sets of 10 or 30 repetitions total. So I'm going to pull, tilt the head, and do 10, 8, 7, 6, 5, 4, 3, 2, 1. And there's just little 1-second pumps to try to fire those muscles and kind of send an electrical message into the musculature that may be involved with the pattern of holding this shift. So that's a way to try to self-correct yourself. Self-correct yourself, that makes sense. Self-correct the problem incrementally throughout the day. So anytime you visit and wash your hands, you have that towel, just take the 10 to 30 seconds to set it up and half a minute to run through it, hang the towel back up, and off you go. So that's for a right shifted neck in this case. All right, good luck with that. Hope that helps.